Hi everybody, this is Dr. Mark McCauley with the EKG Minute. So today we're going to go over the difference between premature atrial contraction and a premature ventricular contraction on an EKG. And the thing is, with the premature atrial contraction, it happens in the atria. And so really what's changing is early on the EKG is the P wave. So you're going to have an early P wave, and you're going to have a P wave that may be a different shape than the usual shape in sinus rhythm. And typically, the QRS wave is actually about the same in sinus rhythm because after this early extra beat comes, it usually comes down the conduction system in the same way that it usually would. And so the QRS is about the same, unless you have something like delayed conduction with aberrancy, which we're not going to show here. Now, in contrast, a premature ventricular contraction occurs in the ventricle. And so it usually occurs outside of the normal conduction system. And so you're going to have a wide QRS that comes unexpectedly early, and you may or may not see a P wave. Sometimes with a PVC, you'll actually see a P wave that trails this as it's going back up to the atria. So here's what it looks like on an EKG. Hopefully this helps. Thanks very much.